So, we would be very happy if you could tell us something about immunotherapy. What is it?
Immunotherapy is a novel way of treating patients with cancer. And it is a way in which we provide the immune system with tools to get a normal anti-cancer response. What we in fact do is we take off the brake from the immune system and allow the immune cells to recognize the cancer again and to kill the cancer cells.
And how is that different from other cancer medications?
Most other drugs are drugs that kill the cells directly. That's one of the big differences. And most of the drugs have other type of side effects. The side effects are completely different. And we can also expect that the efficacy, so the effect of the drugs, are going to be different.
What effect do you expect?
Right now, we expect that patients will benefit, but there are only few patients who will benefit to the immunotherapeutics. I think with the current drugs, 1 out of 5 patients will have an effective anti-cancer treatment.
For which lung cancer patients are these drugs suitable?
The immunotherapeutics are at this point of time going to be suitable for all patients. We don't know how to identify patients who will respond. So we will give them most often to everybody. There is...
Is that only for non-small cell or also for small cell?
For non-small cell, all the data is there.
Yeah.
For small cell, there's only very limited data, and the studies are going to be started. So we will have more insight in that in 1 or 2 years.
But does that mean that everybody with lung cancer could try immunotherapy?
No. If you come to the doctor with lung cancer, we first have to see how extensive the disease is. And this treatment right now is only available for patients with metastasized disease, so with disease which can't be operated, resected anymore, disease which can't be cured anymore.
Yeah. What are the side effects of immunotherapy? Because you say they're different.
Yeah. We are still in a learning curve, so we don't know everything, but the most often occurring side effects are related to what we do. We induce an inflammatory response. We induce inflammation. And what is inflammation? It's something which you have when you have a fever, when you have a flu. So often people are a little bit tired. Sometimes they can develop a rash, so a skin rash. Sometimes they have side effects that are what we call autoimmune related.
How soon will you see if it works?
The patients who have the treatment can develop a response very rapidly. It can occur within weeks, but it can also occur only after 3 months.
Right.
So the normal checkups, follow-ups of patients are comparable to what we did in the past. So we check our patient each 2 or 3 courses of immune therapy. So immune therapy is always given via an infusion. And each 3 or 2 courses, depending on how long those courses take, we do some kind of imaging. That can be a CT scan, or that can be another scan, in order to measure the tumor. And so most often after 6 weeks, we already have an
idea.
An ID.
Yeah. And I understand that it also has a sort of an effect that continues even if you stop the drug?
Yeah, we still don't know exactly how to deal with that, but if you look at the data that have been presented during this meeting and are presenting during other meetings, we see that at a certain time many of the patients stop because of the side effects.
Right.
Or because the study was planned to stop. And even afterwards, patients are often for a long time with a good disease control. In fact, we still don't know how long that long will be.
What patient do you as a doctor right now give this treatment to?
I'm working in a hospital with a lot of research facilities, so a lot of trials are being performed. So many of my patients are being treated within trials.
Yes.
And there are no drugs that are at this moment registered. They are going to be registered very soon, the first drugs. So we expect the first drugs to be registered in Europe in this year. And in the first stage of immune therapy development, we will only treat a very small subset of patients with metastasized non-small cell lung cancer, so lung cancer that can't be cured anymore, and only those who have already received
Other treatments
prior to the immunotherapy.
It's going to be expensive, an expensive drug. Do you think that will reduce its access possibilities for patients? Do you think every patient who would want to try it could get it?
No, we will have issues over there.
Yeah.
They will be very much depending on the country. Each country has its own legislation for approving drugs, and there are going to be countries where it won't be available because of the costs. I'm sure that we will have issues over there. So it's going to be available for all patients in a certain subgroup of lung cancer in a short while.